Hello, I'm Dr. Robert Lelouch, board-certified OB/GYN physician with over 30 years of clinical experience. And today we're going to talk about vaginal infections around the time of menopause, more specifically, atrophic vaginitis. Now, there's a really good companion video that I've made on vaginal estrogen in menopause, and you can watch that as well because a lot of the topics here are complementary. So it's very common for women who have gone through menopause a year or two after to start getting more infections. They can get increased urinary tract infections, and by the way, there's a separate video on that. They can get more vaginal infections, and those vaginal infections are more common as a result of the age, but also of the menopause, the lack of estrogen. And broadly speaking, the most common two infections are atrophic vaginitis and a vaginal yeast infection. You can get more prone to each of those. So atrophic vaginitis, atrophy means thinning of the tissues. And with menopause, the vaginal tissues get thinner. So if you look at a 90-year-old, you notice they always have cuts and bruises on their skin. Well, that's because their skin is so thin, just a small little minor bump can cause a break in the skin, and they can get infected because your skin is your first line of defense for infections, and when it breaks, bacteria can get in. So this happens earlier in the vagina when you go through menopause. With the lack of estrogen, the lining of the vagina, the vaginal wall gets thinner and weaker, and it can get micro tears from movement, from intercourse, from sex, or just because of the change in the bacteria and the yeast there. So if you have a vaginal infection and you have some symptoms, burning, itching, pain, discomfort, it might be atrophic vaginitis, it might be a yeast infection. You're more likely to get a yeast infection if you're pre-diabetic or diabetic, and if you are a little higher in weight, you're a little less likely to get the atrophy, atrophic vaginitis, because fat cells make some estrogen, so you have relatively more estrogen, but you're also more prone to a yeast infection. So the bottom line is, if you're noticing a year or two after menopause more infections, you should get checked out, sort out what it is, and then you may be a candidate for vaginal estrogen, and watch that other video. Again, as I said, there's a lot of overlap to explain what are the benefits of the vaginal estrogen. The treatment is usually either a vaginal antibiotic or oral. It might be something called metronidazole flagyl, it might be clindamycin or Cleocin. There are other treatments, but those are the mainstay treatments. The little micro tears and the infections might make vaginal estrogen burn. So if you're noticing that burn, then you might have that infection. Once it's treated, you need to wait a little bit of time before you get back to intercourse. And if you keep having troubles, you might need, in addition to vaginal estrogen over some time, some vaginal dilators to restore your sexual function if that is becoming an issue. Overall, menopause has many challenges, and atrophic vaginitis is one of those that can be dealt with and can be treated with the help of your gynecologist. I hope you found this information of use. Please leave your comments. Thank you.